inserting an NG tube. First thing I'm going to do is gather my supplies, enter the room, verify my patient, verify their wristband, and make sure that this is the correct patient. I'm going to verify my orders. I'm going to perform hand hygiene and put on my gloves. And I'm going to provide for privacy. Once I have my gloves on, I'm going to check my suction, make sure that it's in working order. Okay, suction is good. And then what I'm going to do is raise my patient to a semi-Fowler's position, have them hyperextend their neck, and I'm checking inside the nasal nares, and I'm checking for patency, examining which nostril I'm going to be able to place my tube in. So the right nostril is a little more patent than the left, so I'm going to apply my NG tube to the right nostril. Okay, and I'm also going to check for gag reflex and have my patient open their mouth, extend their tongue, and then check for gag reflex. Alright, so gag reflex is intact. Next thing I'm going to do is measure for my NG tube, and I'm going to do that through my NG tube. I'm going to measure. I'm measuring from the tip of the nose to the earlobe, and then down to the xiphoid process. Once I have my measurement there, I'm going to contain my measurement by applying a piece of tape. This is how I know how far I'm going to insert my tube. And then I'm going to apply my lubricant to my tip of the tube. Apply my lubricant. And I'm going to place my chucks here, provide my patient with a glass of water for them to sip on, and a tissue just in case. I'm going to start inserting my NG. Okay, I'm going to have my patient hyperextend their neck, start to insert the tube, and as soon as they gag, I'm going to have them sit down on water and push their neck down. And if I meet resistance, I would draw back about 2 centimeters. Or pause it. If I meet resistance, I'm going to pull out my tube and insert on the other side. Continue to insert my NG tube and have my patients sip water as they need. And once I get down to my marking, then I'm going to secure my tube, just a light secure.
Yep.
Secure this. And I'm going to, okay. So once it's in there and just loosely secured, I'm going to check for placement. And the first thing I'm going to do is aspirate my my contents and check the pH. And then the next thing I would do is insert 10 to 20 cc's of air and going to insert the air and auscultate the epigastric. And I'm listening for gurgling. The most accurate way to check for placement is the chest x-ray. Okay. So once the placement is checked, then I can connect my suction and fully secure my NG tube. Alright, so once it has been secured, then I can document my procedure. I would document the time and date that the NG tube was inserted, how the patient tolerated the procedure, and then I would make sure that my line is secured here and that the suction is placed. at shoulder length.